Chair Baldwin, Ranking Member Capito, and members of the subcommittee, thank you for inviting me to testify on the 2025 budget. When President Biden took office, I think it's important to note, back in January 2021, COVID was ravaging our families and our economy, and thousands of Americans were dying every day. Thousands of Americans were dying every day. About 4,000 died the day that President Biden took office. In January 2021, the number of Americans with health insurance was, like our jobs and the economy, down and on the canvas. Prescription drug prices were skyrocketing, with patients and their pocketbooks at the mercy of Big Pharma and its profits. We changed that. Today, 3 years later, nearly 700 million shots of COVID vaccines have gone into the arms of Americans. COVID is still around, but we can now manage it like the flu. Today, more than 300 million Americans, a record number, can go to the doctor or hospital and not go bankrupt because they have their own health insurance. More than 21 million of those Americans count on the Affordable Care Act marketplace for their insurance. That's another record. Today, while Big Pharma is still big, the President's new prescription drug law has brought down the price of insulin to $35 per month for Americans on Medicare. And as we speak, we are negotiating with drug companies to lower the price of even more prescription drugs, even as they sue us to stop us. The President's budget doubles down on the investments that made the comeback of our jobs, our economy, and our health possible. It doesn't just protect Medicare. This budget strengthens it beyond Medicare's lifetime and beyond our lifetime. This budget lays out a vision for a nation that invests in its most vulnerable, it fosters innovation, and it protects every American's access to the care that she needs. Perhaps most importantly, it continues our shift from a health system that treats illness to one that sustains wellness. All told, the FY 2025 budget proposes more than $130 billion in discretionary and about $1.7 trillion in mandatory funding to advance our mission and invest in key priorities. Let me share a few of those highlights. The budget provides Medicaid-like coverage to low-income individuals in the outlier states that have not expanded Medicaid under the Affordable Care Act. When that happens, another 1.5 million of our fellow Americans will have health care coverage and the peace of mind that comes with it. This budget builds on the largest investment in behavioral health in a generation. It bolsters the 988 Suicide and Crisis Lifeline. It gives young people support at home and at school. The President's investments in behavioral health workforce would add 12,000 new psychiatrists, psychologists, clinical social workers, marriage and family therapists, counselors, and peer support specialists at a time when their services are desperately needed. Across HHS, the budget tackles a maternal health crisis by improving access to pre- and postnatal care, supporting emergency care services, and expanding maternal care in rural and underserved communities. We are also making child care more affordable for working families and more available where families live and work. This budget would provide increased wages for early childhood education workers. It would fund more than 750,000 slots for children in Head Start, and it provides universal preschool for our nation's 4 million four-year-old children, and eventually would include our 3-year-olds as well. Our budget grows and strengthens our cybersecurity initiatives to ensure patient safety and privacy, and to keep our hospitals and providers, especially smaller ones and those in rural communities, running and secure. Finally, this administration has made tremendous strides in preparedness capabilities since the pandemic, and we keep building. This budget invests in countermeasures to combat antimicrobial-resistant drugs. It expands our monitoring of supply chains, and it integrates 200 data sources across federal, state, and local governments to improve information sharing. We can't reduce the health and well-being of Americans to a line on a budget spreadsheet, but we can transform the numbers on the balance sheet into real investments and services that sustain health and promote wellness for all Americans. With that, I thank you for this opportunity, and I look forward to your questions.